Hello, my name is Debs Patton and I'm Professor of Anatomy here at the University of Sunderland. We're standing outside our anatomy facility and I'd like to take you inside, so if you just follow me. So we're here in the lab and you can see that we've got a wealth of resources in the lab here. So around the room we see lots of anatomical models and these represent anatomy across all of the body systems. On the back wall you can see that we've got some computers and these are preloaded with very specialised anatomical software, and then over here we can see our anatomage table. We also use portable ultrasound here in our teaching to deliver living anatomy teaching so that we can see anatomy and physiology in class as well. So this is one of our portable ultrasound machines that we use with patient carer, public involvement individuals, and our students get an opportunity to scan in the lab with those individuals. So we've got a number of these pieces of equipment, and we also have these handheld devices here. So we've got 6 or 7 of these, and these are used in class as well. So we've got lots of equipment for all of our students to scan. If we move over to this side of the lab, you can see that we have an anatomage table here. So this is essentially a tool that enables us to digitally dissect the human body. So here we can see that we've got a representation of the renal system, so we've got the kidneys and the urinary bladder here, and you can colour code blood vessels and nerves and lymphatic structures, and you can colour code organs and essentially highlight really pertinent anatomy in a meaningful way. And you can also use this type of software to not only dissect away structures but to construct them and build them up from the very essential basic building blocks of the anatomy. And we found this a really useful and valuable way to deliver anatomy teaching here in the lab. We also use body painting in class to study living anatomy and surface anatomy. So surface anatomy is knowing where to find organs underneath the surface of the skin by palpating the surface of the skin. So typically you would do it in conjunction with a skeleton, and we use body paint on the surface of the skin to help students paint on where organs are in the body. And students really appreciate and enjoy this kind of activity in class. It's lots of fun, and we try to include that where we can. So in summary, we use computer-aided technology, we use anatomage, we use our anatomical models and ultrasound and body painting for surface anatomy and other things here and there. If you look outside of the window, you'll see that we're building a cadaveric laboratory right at this moment, and this will be ready in 2022. Essentially, this lab will be translocated into that new facility, and in the middle of that laboratory will be our cadaveric suite. So we'll be using a prosection-based curriculum to deliver anatomy, along with all of these fabulous resources that we've been using thus far. So we'll really be able to offer our students a truly blended and integrated approach to their anatomy experience in medicine, and we're very much looking forward to that. I hope you've enjoyed this little look around the lab today and that it's given you a flavour of the resources that we use to teach anatomy. In terms of sort of staff-student ratio, in class, typically we'd have about 25 students in class with 3 or 4 staff. So we have really good staff-to-student ratios in anatomy, and we'll carry that forward into our cadaveric suite when we have it ready. And we're really looking forward to seeing you in the lab soon. Thank you.